everyone. I am excited to be here today. It's our Tell-All Tuesday format, but it's not a Tuesday. I'm so excited to have Dr. Serena Chen with me again. Thank you so much. She just ran out of the operating room and jumped on the computer to be here because this is such an important question. A couple weeks ago, a client of mine asked me about timed intercourse, or when you should have intercourse when you're trying to conceive. And Dr. Chin and I were just talking about this. I know what it was, 20 something years ago, but I was hoping that we could have some conversation and dialogue around that. So when you're trying to conceive, should you have intercourse every day or every other day? There's so much information out there and it's so confusing.
It is so confusing. I totally agree. And I will tell you, a lot of people, I get this question, it's often at the end of a consult, when after people get to know me a little bit and they realize I'm not scary or intimidating. And it's often asked with a little bit of embarrassment, because I think it is a tough question to ask somebody, and it's because it's about obviously a very private, intimate thing. And yet it's so important to conceiving. And people really want to know. So I will tell you, I get this question every day. You're not alone. People asking Dr. Google, and Dr. Google is tough because Dr. Google gives hundreds and hundreds of answers, and they are confusing. And there are a lot of Google answers out there saying that it's really, really important to get the timing right and to have lots and lots of sex all the time and just at the right time. And so I do have a lot of patients that are actually getting super stressed out about timing. I had one gentleman, bless his soul, they did eventually have a baby, but they when they came to see me, they were so stressed out about this timing issue that he actually had trouble ejaculating when he thought his wife was ovulating. So that's how, they had to go to therapy. It was just awful. It really has some negative consequences, misinformation, and getting stressed out over that. So I really want people to know that this whole precise timing thing it's really kind of a myth. You do have to have sex. So
right.
You're not up to immaculate conception yet. So you do have to have sex. But if you are having sex a couple times a week on a fairly regular basis, you're covered, okay? The sperm is normal. Good sperm can last in the female reproductive tract, usually hangs out in the cervical mucus and in the tubes, because there's actually sperm food there. That's what we provide. Our bodies do that for us. That's a normal environment, and the sperm can hang out there for over a week, sometimes even longer. So in a typical 28-day cycle, so after you finish bleeding, let's say your period is 4 or 5 days, which is a typical average, right around day 6 up until ovulation around day 14 or 15. And then for 24 hours after the egg is released, that entire time is your fertile time. And that does not mean having sex every day or every other day or twice a day. It just means during that time, maybe 7 to 10 day period, try to get 2 dates in a week. And really, truly, you are covered. Now, what if your tubes are blocked? Or what if you're not ovulating? Or what if the sperm is no good? Well, then it's not going to work. You'll have unprotected intercourse for 6 to 12 months, over 35 after 6 months. Come see the doctor, get evaluated. Over 12 months, if you're under 35, get evaluated. But if everything's working, trying harder is only going to put more stress on your plate, and it's not going to improve your chance of success. So, you should relax. Sex is supposed to be fun. It's supposed to be fun and loving and a way for the two of you to bond and hopefully have a baby. But working hard at it and trying hard actually just causes stress and doesn't actually improve the pregnancy rate. And we do have data to show this and studies to show that.
Well, for a type A personality, which I can raise my hand because I was that when I was going through this, you think I'm going to carpet bomb and it's going to, I'm going to push and shove and make sure this happens. But just the way you were talking about it made me relax, and I'm not trying right now, so. So I appreciate that. I appreciate your insight and your wisdom. So let's go step back for a little bit. So of course it is after 6 months, 35 or older, or after 12 months. But then you have those women who, you just have that motivation that you want to take a stronger action. So that's okay too, right, doctor?
Absolutely. And if your doctor is poo-pooing you, honestly, you probably need to seek a second opinion, because if it's a concern of yours, then it should be a concern of mine. And I'm not going to put you in danger and do anything crazy or overly aggressive. But if you want information, you deserve to have an exam and to talk with an expert and to be able to do some reasonable testing. There is really no reason that you cannot do that. And sometimes people do have instincts. Like I do have patients who they don't know why, but they just feel like something's going on. They need to see the doctor. And sometimes they're right about that. So somebody's seeking help and information, I never turn them away. So if a doctor is poo-pooing you and you're feeling like you really need more information and you want to be evaluated, then find somebody who will work with you. I really don't think there's anything wrong with that. I think that's a great point, Kristen. The other thing is, when we say 6 to 12 months, these are for women who have really no medical problems.
Right.
Healthy. They've had good GYN checkups. Their cycles are regular. There's no history of previous surgery or treatment. There's no family history of endometriosis. There's no family history of premature ovarian failure. There's no family history of PCOS. Even with just a family history of PCOS, polycystic ovarian syndrome, endometriosis, and premature ovarian failure, your risks for those things do increase significantly. And I feel like that kind of history, that's enough reason to, talk with your gynecologist. Sometimes, if your gynecologist is not open to it, maybe even see a reproductive endocrinologist. I don't feel like that's overly aggressive. It's not like I'm taking you to the OR. All we're doing is talking and getting in.
So if we shift gears now for the guys, and you participate in the Making Dad Summit. So if you're a gentleman in the relationship that's deciding that you want to create a family, and the last time that you've been seen by a pediatrician was maybe when you were 17 or 18, when you saw your pediatrician, it's the same for men. Like if you were trying to conceive and you have not had a health checkup, you need to go see your doctor, and because that is so non-invasive for men, just to get a little checkup and maybe provide you, a reproductive endocrinologist, with some information from a reproductive urologist. So, I think there's so much you can do that's not invasive.
Yes, absolutely. And you're right, guys tend not to like to see the doctor. There is a very large study from Stanford recently showing that the guys in couples that are trying to conceive, if they're having a little bit of trouble, even if the semen analysis looks okay, there's a little bit higher prevalence of health issues like cholesterol, high blood pressure, diabetes, heart disease. I totally agree, it cannot hurt to get a checkup.
So thank you so much. This is so important. We're going to post this on social media, and I so appreciate you're always ready to give your wisdom and your advice. And people can reach out to you through the clinic and your email. Is that correct?
Absolutely. So I'm at schen@sbivf.com. So SCHEN@sbivf.com. And at sbivf.com for our website. We have a lot of information on there that hopefully is not quite as confusing as just searching on Google. And so you can reach out to me, and happy to talk.
Great. I'll put that all underneath the video. So thank you so much. Have a great rest of the day. I know you're so busy, and I appreciate you so much.
Yeah, because I love